What if I told you that every month in Canada, an airplane full of people crashed and everyone on board was killed? Would you be alarmed? Good morning. My name is Dr. Eileen and I'm Toronto's Medical Officer of Health. I'm responsible for leading our city's public health department. So let me tell you what this means. In public health, we look after the health of the population. While most doctors take care of individual patients, my job is to take care of the city. At Toronto Public Health, we run immunization clinics, we inspect restaurants, and we push for smoke-free public spaces. Our job is to make our people and our city healthier. I started this job about 1.5 years ago, and I quickly realized that we were facing the defining health crisis of our time. A crisis for which more action was needed not just now, but yesterday. I'm talking about the opioid overdose crisis. So I started to think back about health crises of the past and their impact on our society. So for example, in 1995, the worst year in our fight in Canada against AIDS, almost 2,000 people died from HIV. In 2003, there were 44 deaths across Canada from SARS. And in 2009, H1N1, the flu that impacted the whole world, took the lives of about 400 Canadians. All of these combined don't even add up to the problem we're facing today. Last year, more than 4,000 Canadians died from an accidental opioid overdose. That's like losing the entire population of a small town in 1 year. 308 of those deaths happened right here in Toronto. These deaths didn't have to happen. Too many people are dying, and these deaths are preventable. If you're between the ages of 30 and 39 in Canada, opioid overdose is now your leading cause of preventable death. And in BC, the epicenter of our country's overdose crisis, for the first time in decades, life expectancy has actually gone down. And if current trends continue, we here in Toronto and in the rest of the country, we will be living shorter lives. Too many people are dying, and these are preventable deaths. So, why aren't we paying more attention to this devastating issue? In Canada, the opioid overdose emergency is claiming the equivalent of a fully loaded airplane every single month. Why aren't we doing more? To answer this question, we need to go back to 1971, when US President Richard Nixon first declared drug abuse to be public enemy number 1. This marked the start of the war on drugs. And ever since then, we, as a society, have tended to view those who use illegal drugs as criminals, as morally flawed people who consciously choose the wrong path. In reality, we don't know how many people are struggling with opioid addiction. But we do know that these people, well, they're our family members, they're our friends, and they are our colleagues. And the paths that led them to drug use, they're not so cut and dry. Take, for example, the young emergency room doctor who looked like he had the perfect life. He got hooked on fentanyl after a back injury, and then he lost it all. Or the young girl from an upper middle class family who overdosed on the pain meds that she was prescribed to help her cope with her illness. Or the young Toronto criminal lawyer who recently died from a fentanyl overdose. He went out for a night on the town with friends, and he never made it home. And then there are those who turn to street drugs to help them cope with the harsh realities of their lives. Childhood trauma, abuse, homelessness, mental illness, and many, many other challenges. Too many people are dying, and these deaths are preventable. The fact is that people from all walks of life use drugs. When you have a headache, you take a Tylenol. When you're sick, you get a prescription. Need a pick-me-up? You grab a cup of coffee. Had a rough day at the office? You have a beer or a glass of wine at the end of the day to help you relax. We all use drugs. This is a fact of life. What's interesting is that defining what drugs are legal and what drugs are not is not actually based on the risk of harm. In fact, alcohol was illegal about 100 years ago in North America. And it's not like the law was changed because alcohol got safer. In fact, while alcohol is legal, it still causes significant harm, from impaired driving to worsening violence and alcohol-related cancers. The bottom line is that all drugs have the potential to cause harm. People have always used drugs, and they will continue to use drugs. We need to be honest about this. Despite trillions of dollars spent on the war on drugs, the global illegal drug market is worth about $650 billion each and every year. That's roughly the gross domestic product of Switzerland. And those countries that have the strictest drug laws or have the harshest penalties for drug use, they're not winning the war either. So what can we do? For starters, we need to admit that we've lost the war. We need to raise the white flag. We need to stop punishing people. We need to take a more compassionate approach. We need to recognize that drugs are not the enemy. Coffee, chocolate, wine, cigarettes, and weed. For others, painkillers, cocaine, morphine, heroin, and yes, fentanyl. Drugs are a part of our society, and we all use them. Rationalizing which drugs are good and which ones are bad gets us nowhere. Wouldn't we all do better if we stopped judging? My advice is that we need to treat problem drug use as a health issue, not a criminal issue. And the good news is that there are other places throughout the world that have already done this, and they're getting results. Countries that have decriminalized drug use and invested in public health approaches are starting to see things improve. For example, in the late 1990s, Portugal had amongst the highest rates of illegal drug use in all of Western Europe. If you can believe it, 100,000 people, that's 1% of the entire population of Portugal, was using heroin. And because so many people were injecting the drug, Portugal also had high rates of HIV and hepatitis C. So in 2001, Portugal started rethinking their policies and rethinking their approach. The United States, they doubled down on the war on drugs. Portugal, they went the other way. They decriminalized drug use. They invested in a major public health campaign. They focused on prevention. They focused on harm reduction. They focused on treatment. They focused on people. Fast forward 17 years, and Portugal has seen huge reductions in drug use. From 100,000 people using heroin in 2001 down to 25,000 in 2017. More people in Portugal are now accessing treatment. Fewer people are dying from overdose. And HIV transmission, it's gone down. Now, don't get me wrong. The Portugal solution is not a perfect solution. There are still people in Portugal who struggle with addiction, and there are still people in Portugal who are dying from overdose. But their approach is both more humane and it's more successful. Portugal ended the war on drugs. Portugal made peace with drugs. Now, the Portugal approach may seem drastic or radical, but remember, there was a time not that long ago when we used to rent videos. Remember Blockbuster? Well, now we watch Netflix. We used to buy CDs. Now we stream music. We used to go to the mall. Some of us went there a lot. Now we shop online. So let's learn from Portugal. Let's not be afraid to change. Let's see the possibilities. We can increase access to treatment. We can save lives by providing more harm reduction. We can create housing and mental health supports for the vulnerable. And above all, we can treat drug use as a health issue. Too many people are dying, and these deaths are preventable. So let's change the story. Let's change our thinking. Let's change our actions. There is hope, and there is a way forward. Together, we can save more lives and prevent deaths. Together, we can make our people and our city healthier. I'm Dr. Eileen Davila, Toronto's Medical Officer of Health. Thank you so much for listening.